that story brings us to this one. This month is National Women's Health Month. And one of the tests that doctors say all women should get is a skin cancer screening. So we have Dr. Angela DeRosa back with us this morning, and you say that there are actually 5 tests that we need to be thinking about getting, and then there are a few that we need to not worry about at all. And we'll get to all of them here.
Absolutely. And when we look at the 5 tests that we need to get, certainly as we talk about skin cancer, you need to have a good skin cancer screening. And that includes getting fully undressed and disrobed in front of your physician and having them look at every part of your body for moles.
Is this something we have to ask for, or is this something that is typically done when we go in for our annual?
Well, unfortunately, I think most providers should be doing these types of exams, and we're taught to do them as part of our annual physical. However, not that we've gotten lazy, but when we're talking about time constraints, sometimes it may be quicker to not do that part of the exam. So if you're not getting that when you're disrobing, in particular women when they're doing their pap smears, they should be in a gown, fully looked at front and back as part of their screen.
So don't be afraid to ask for it. One of the most interesting numbers here, the American Cancer Society anticipates Arizona will have 1,650 new cases.
Yes.
New cases of melanoma this year alone.
Absolutely, and it's alarming how deadly it can be. We have a lot of young women these days who are coming in with these melanomas from tanning excessively or getting sunburned in these sunbeds, and it's deadly. It will kill people. I've had, my worst case was a 21-year-old woman who died because she had a melanoma in between her toe from sunbed.
Oh my gosh, and she probably didn't even know it was there.
No, and we found it on a routine exam, and unfortunately she died a year later.
Oh, that is so sad.
But it's preventative. We just need to look.
We need to be talking about these things. All right, let's get to number 2 here, EKG. You say we all need these.
Yes, every woman and man, for that matter, at the age of 50 should be getting annual EKGs, and this is looking for the electrical conductivity of your heart to make sure that it's properly functioning, and sometimes it can show signs that the heart is actually not getting enough oxygen, and that can lead to heart attacks down the road. So what's interesting is we're so focused on breast cancer in women, but the #1 killer in women is heart disease, and it's so easy to start screening for and listen to the patients as they talk about their symptoms.
What's interesting is that we talk about this all the time, that heart disease is the #1 killer among women, but it's not until we lose someone who's very important to us, or someone, you know, a loved one goes through a heart attack, or we go through a heart attack, and then it seems like we dig deeper on this.
And certainly we're seeing more and more heart attacks in women in their 40s and 50s, and a lot of it's due to our lifestyle as well as the stressors that we're encountering in our life. And unfortunately, women present with heart disease much differently than men. They typically get the chest pain like someone's sitting on their chest, the arm pain, the jaw pain, and all those things. But women can simply just have a feeling of dreaded doom or fatigue or just not quite right, or even indigestion.
Something feels a little weird and off, so listen to your body. Pap smears, number 3.
Yes, as much as we don't like to exams, the dreaded pap smear, but it's so important to have it done because certainly cervical cancer is preventative. And with the advent of the pap smear, cervical cancers have decreased tremendously, and they're almost non-existent if we can keep an eye on them.
Number 4 is mammograms. We've heard so much about this. Number 5, a colonoscopy.
Yes, as much as we don't like pap smears, colonoscopies definitely take the #1 hit. People don't like to think about doing a colonoscopy. The preparations are terrible, but rectal cancers, colon cancers are very, very prevalent, and especially with today's diet, we need to be looking.
We so often associate this with men, not women. Okay, the 5 that you just don't need. Can you run through these quickly so that the women out there know that, okay, you might be wasting your money
and
time?
Wasting money, time. Unfortunately, there's a lot of naturopathic physicians and other physicians who are looking at ways to make income and money. But salivary hormone testing, hair analysis for nutrients, certainly DEXA scans in the wrong patient population. There are some women, if you fractured your hip already, you don't need a DEXA scan to be treated. But for women who are just assessing risk, they're good to have done. But unfortunately, we're overusing them to guide our treatment, and certainly we need to look at clinical risk, which means if you fractured, you don't need a DEXA, you need treatment. If you're low risk and you're very young, you don't need a DEXA, you need preventative care. But if you are of medium risk, you should be getting one. Coronary calcium screenings, oftentimes with the information we gather from them, we have no idea what to do with it. And Canada screenings, we have a lot of people testing for yeast, but we all have some yeast, and it's worthless to be looking for it because you don't need treatment for it.
All right, well, thank you for your insight this morning, and we really appreciate it because, you know, time is everything, especially when you're maybe a busy mom or someone who's trying to buzz around. So hopefully we've helped you this morning. We'll have more information on Dr. DeRosa on our hotline.